Patients are often confused about where they should go and when they should go to all those different avenues. And the answer really is related to each individual problem. So we can't go through every problem, but as a general rule, we need to look at whether something is urgent or whether something can wait. And if you need urgent care and your practice isn't available, that's when you should be calling 111. One of the issues really is, what do you define as urgent? And most people define as urgent something that will potentially deteriorate and get significantly worse in the hours until their practice is next available, which may be in a few hours or maybe the next day. And what we do see a lot in the out of hours period is people who have an urgency which is more again related to their want rather than to their need. So we will get people ringing 111 who've had a sore throat for 2 hours and not tried any of the simple measures. And for many things, you can try those simple measures and try the over-the-counter treatments. And that means having a quick chat with your pharmacist. And in many ways, for minor illness and minor injury, small burns and scalds and small scratches and even simple rashes, you can discuss this with your pharmacist. There is a community pharmacist consultation scheme now where they can actually give you a consultation in a private area, and you can actually have the benefit of the pharmacist and their experience and what is available over the counter to treat many minor injuries and illnesses. Chronic problems that have suddenly got worse, again, it does come down to how unwell you are and whether you can wait. And some of that has to be determined by how you are at the time. But simple illnesses and simple problems should really be going to local advice first and then to 111. It's incredible the number of people that will call with vomiting and diarrhoea, which are actually the body's ways of expelling something that's toxic to the body from the abdomen and from the gastroenteritis system. And effectively, small bouts of vomiting and diarrhoea, if they're short-lived and not recurrent, don't need medical input. They just need simple, straightforward self-care again. So the question that you need to be asking is, can I self-care for this? Can I get something over the counter for this? Have I done that? Have I tried that? But going forwards from there, when you look at things like injuries, if you've actually sprained an ankle or sprained a knee, twisted something, or if you've got a muscle ache or pain, again, it's where's the most appropriate place to go with that. And for simple things, if it's not actually stopping you doing anything, you should be considering whether your practice might have access to a physiotherapist, or whether you can actually access one yourself. For many of the physiotherapists in York, you can self-refer and you can get advice, again, usually an assessment over the phone first of all, but if necessary face-to-face from them. And on an ongoing basis, that's really the determination you need to make, is rather than thinking, I should ring somebody and get them to tell me what to do, you should be thinking, have I tried all the self-care methods that I can try before you seek that expert advice and take up that time that could be used with people who are suffering from chronic problems with more complex issues and things that are not so minor on a day-to-day basis. Now, that's not belittling anybody's illness, because for you, that bout of diarrhoea or that bout of vomiting is very significant at that time and on that day. But really what you should be considering is this like to be short-lived? And could I deal with it myself without having to get advice? One special case for everyone is children. As parents, and I've been a parent, I've got 4 children of my own, all grown up now, but I understand completely, as does every GP, that the concerns when you've got a responsibility of looking after a child are huge. And children can't tell us everything that's going on with them and won't necessarily come forward when they're unwell. And particularly young babies and toddlers aren't able to articulate or tell you what's going on. They're a special case. There are some very good, very clear guidelines and help available One of them is the website whenshouldIworry.com, which actually will give you some clear indications and clear information of when you should be seeking further help, and again, what self-care and what self-management you can do with your child whilst waiting for that help and advice. We would never advocate that if a child is unwell that you should stop and not actually access that help and advice. As GPs, we understand that there are vulnerable members of our society that we need to take care of and we need to support. And what we need from everyone is to allow us that ability to do so. And the biggest and most significant worry, I think, for many people in the healthcare profession is that with this increased demand we have at the moment, it is almost impossible to actually allow us to give that greater care to people who are lost in that huge sea of demand, that huge wave and tsunami of everyone trying to get access to general practice. And we do not want the situation where vulnerable individuals will deteriorate whilst we're dealing with things that could have been dealt with in other ways.